трансляция?
Она уже идет сама по себе.
То есть она, в принципе, начинает.
Да, вы можете спросить, они вам будут такой фидбэк небольшой делать, отвечать на вопросы.
А чат, это, секундочку, вот здесь вот, да, просто пишу?
Вот он вам, да, когда вы его выделите, просто потом на презентацию переключитесь.
Все, хорошо. Hello, colleagues. Are you hearing me? Somebody here? Well, firstly, is everybody here? Please write something in general chat who are present. Okay, 3 of you I see. That's all. Well, colleagues, I give you 5 minutes to gather everybody who want listening, yeah, and then we start. Okay. Oh, well, before we starting, I see Monica Dagur is here. Yeah, it's group. It's group 11731. Monica, please, if you're hearing me, write something in chat. Monica Dagur, today I send you invitation in friend in contact social network. Please receive this invitation and share my my page to everybody of your group. Okay, we need to make conversation on our practical lesson in contact group. Our lessons start on 15th of September. Okay, but we must create group today or tomorrow. Monica, clear? And everybody from this group 1731, yes, I'll read all members of your group, and I give Monica a link to my page, and she share between everybody of your group. And then we create the group for practical lesson. So group 1731, it is Ali Ahmed Ismail, Bharti Aditya, Bhat Mauli Sandeep Kumar, Viradya Rutin Bhai Bhagavan Bhai, Gadhia Satish, Dagur Monika, Kapadia Sahil Parvez, Maradia Venus Kumar, Patel Dhrumil, Patel Kunjkumar, Penumala Rajvilson, Pradhan Twinkil, Sonia Harshita, Chaudhary Vikas. Well, okay, just 3 minutes and we begin. Well, in India, what is the period of day is now? How many times in India? Oh, okay, it's 4:28. It is the PM. Oh, okay, I see. So it is the evening. Okay. uh, do you have a chief of your course? How many persons are in course? So how many students are in course here? Well, okay. Let's start our communication. So, firstly, I want to congratulate you with the beginning of the new student year. Uh, of course, the world situation with the coronavirus disease uh, play significant role in the format of our studying, but unfortunately some things are not depend from us, and we need to deal with this situation, and we of course try to give your all knowledges as we can in such format. Uh, from this year, there is some changes in format of practical lesson. And firstly, what I want to say that attending of all lectures give you plus 1 point to general mark that you receive after you finish our discipline. And I think that such format, distance format of lecture, from this point of view, allow you to visit all lecture, and I think it is of course more convenient for you. What about practical lesson? I think we discuss it more closely inside the groups. There are also some changes, and we will speak about it in contact. So before starting lecture, of course, I want to suggest you mainly and firstly the strong health to you and your relatives, and I want to wish you to avoid problems with health and avoid these infections, disease that spread all around the world. So let's start our lecture. So today we speak about rhinitis, acute and chronic sinusitis. What about practical lesson? No, this slide was done before we know information about distance practical lessons, but here you can see what topic you must prepare to the first practical lesson. It is clinical anatomy, physiology and methods of investigation of nose and paranasal sinuses. The whole list of practical lesson I'll give in group in contact. As we are going to study distantly, of course, yes, you the second shoes, white heads are not important. Yes, we will communicate distantly in right form. What is otorhinolaryngology? Otorhinolaryngology is a clinical surgical discipline which studies morphology, physiology, and pathology of ear, upper airways, and adjacent regions. So, why our discipline is called so? Yeah, this name goes from Latin name of our regions, what the regions with which we deal with. Yes, so otus, it means in Latin ear, rhinus, nose, larynx, throat. And what I want to say, if there is maybe some problems with the sound or anybody else, please write about it in general chat. So our discipline is quite interesting because it's connected with a lot of other disciplines and with a lot of other organs and system. Yeah. For example, we have very close connection with neurology, neurosurgery, ophthalmology, dentistry, therapy, infectious disease, dermatology, allergology, and immunology. So you can see that ENT diseases play significant role in general structure of medicine. Yes, because quite often some symptoms from the ear or from nose or from the larynx may be initial signs of problems of other organs and systems. So we begin from the some anatomical notes. Yeah. So nasal cavity, as we are speaking today about rhinitis and sinusitis, so just remember anatomy of these zones. So nasal cavity is an initial part of respiratory tract. And nasal cavity is one of the two main anatomical regions of the nose. So it's nasal cavity and paranasal sinuses. So nasal cavity. Nasal cavity has 6 walls. Medial wall or nasal septum, top or superior wall or tegmen, floor of nose or inferior wall, lateral wall, anterior wall, it's the hole that forms by nostrils, and posterior wall, it's the hole that names coans that connect nasal cavity with nasopharynx. Yes, and nasopharynx is the superior part of pharynx. By the way, as far as I understand, you can't see presentation, yes? You just hearing, correct? Do you see slides or no? Colleagues, please write somebody. Do you see presentation or no? Okay, continue. So, in nasal cavity, we divide 3 nasal turbinates, yeah? Superior concha, middle concha, inferior concha. Concha is the synonym of turbinate. And these 3 nasal turbinates form 3 nasal meatuses. So these 3 nasal meatuses are very important part of nose, and during the lecture you understand why. So superior nasal meatus localized between superior nasal concha and middle nasal concha. Middle nasal meatus is localized between middle concha and inferior concha, and inferior nasal meatus localized between inferior nasal concha and floor of nose. Yeah. Nasal cavity has 2 functional areas. Yeah. So the main and the most large area, it is respiratory. area, yes, marked in blue. So, and the localization is from the floor of nose up to superior edge of the middle nasal concha, yeah, and olfactory region. It is the middle surface in green side, yeah, marked a medial surface of the middle nasal concha and superior nasal meatus area. So from the definition of this area, yes, you understand that respiratory region is responsible for nasal breathing, yeah, and of course the air pass also through the olfactory region, but only in olfactory region olfactory nerves, yes, that allow us to percept smelling is localized. So the key zone in nose and in nasal surgery is so-called osteomeatal complex. So osteomeatal complex is a part of the ethmoidal bone and represents the system of courses and apertures in the area of anterior part of nasal uh, of middle nasal meatus. So why and here, yes, you can see all structures that form osteomeatal complex. Yeah, here it is processus uncinnatus. Here hiatus semilunaris, ethmoid bulla, infundibulum here. Yeah, maxillary osseum. It's the maxilla sinus, and inferior turbinate, middle turbinate. So why this zone is very important? Yes, because in this zone all groups of anterior paranasal sinuses are drained. Yeah, so here is the place of draining of maxillary sinus. Here it is so-called here, yes, you can see frontal sinus that drain through the nasofrontal channel also drain in this zone, and through the ethmoid bulla, ethmoid cells anterior group also drained in this zone. So any problems that narrowed this zone or blocked this zone, yeah, leads to possible problems with all this group of sinuses. Yes, here you can see the CT scan films of also of this zone. For example, here here you can see this patient after operation on the osteomeatal complex. Yes, here you can see very large, yeah, zone where processus uncinnatus is absent, yeah, where ethmoid bulla is destroyed, yes, by surgeon. And you can see that maxillar sinus and ethmoid cells very free drain to nasal cavity. So for example, on this picture you can see how this zone is looked before operation. Yeah, so you can see that there is no free passing from the maxillar sinus to nasal cavity. Also, yes, here you can see this zone: processus uncinnatus, ethmoid bulla, ethmoid cells, middle concha, inferior concha, and nasal septum. Also very important part in nasal anatomy is nasal valve. Nasal valve is specific triangular rimous formation between the lateral cartilage in place of its attachment to septum nasi and septum itself. Here, yes, you can see it's the nasal valve. The nasal valve angle is an angle between the lateral cartilage and septum nasi. Here, yes, this you can see this angle. As you remember, I think from the anatomy, from the physiology, the nasal breathing is very, very important for organism. And as you are from India, I think you know about yogas, yeah, and in yoga system, free nasal breathing play very significant role. So the spiratory area of nasal cavity is covered with multirow or pseudostratified cylindric ciliary epithelium, which contains of three main groups of cells. It's the cilia cells, and you see the small cilia on the apex of this cell. Goblet cells that produce nasal mucosa, and basal cells that are a source of differentiation of all other cells. So the ciliary cells has 300 cilia on the top, and speed of the cilia beat is 60 to 1200 times a minute. So yeah, return to this picture. So all these cells, the basal lamina, and all glands form so-called mucociliary transport system. So what is this? Cilia are covered with mucus, secretion of mucus and serous glands and goblet cells, and all these parts form mucociliary transport system that provide the nasal cavity clarification. Mucociliary clearance is the first protection line. It prevents fixation of alive or dead antigenic materials on the surface of mucous membrane and its penetration inside. So what does it mean? For example, if some bacteria or virus appear in nasal cavity, firstly it contact with the mucus of the nasal cavity, and if of these components of mucociliary transport system is functioning well, the main part of this microorganism transport from the nasal cavity to nasopharynx and then in stomach, and this mucus prevent prolonged contact of this microorganism with the mucus lining of the nasal cavity. So the basic membrane, yes, divide the mucous membrane of the nasal cavity in two layers, yes, as we spoke. It's epithelial layer and lamina propria. The second line of protection provides local immunity. What does it mean? Mucus contains non-specific and specific factors of protection. It carries out the next function. Recognition, so inactivation, destruction, neutralization, and the removing of the foreign antigenic material from the nasal cavity. It means that mucus contains biological active components as lysathin, yeah, as secretory immunoglobulin A that can inactivate microorganisms. So, what are the functions of nasal cavity? Of course, the main is respiratory, yeah, because only breathing through the nose allow our organism to only breathing through the nose protect our organism in maximum form. Because if somebody is breathing through the mouth, all other functions are switched off. So functions: respiratory, clear; protective, so it's the mucociliary transport system; reflex, we will speak later about it; conditioning, it means that during passing through the nasal cavity, breathing air can be more maybe as warmer, so colder, cooler. Information, it means that contact with different antigens with nasal mucosa allow to form immune answer. Secretory is the part of mucociliary transport system, aspirating and olfactory. And while passing the nasal cavity, the air is cleared, warmed, humidified, and neutralized from the different antigens. So, inhalation is an air stream along the middle nasal concha, and you can see that it's look like turbulent movement. Yeah, and 60% of pathogenic microflora settle down in the nasal cavity and is neutralized here. Exhalation is an air stream along the inferior nasal concha through the coan. The ostia is in 3-4 times more than the nasal valve ostia. So, what is reflex function? 3 groups of reflexes are distinguished: intranasal, thorns, crests, arise in the nasal cavity, influence the function of the remote organs, trigeminal nerve neuropathy, bronchial asthma, and the irritation in other organ causes changes in nasal cavity, cooling pregnancy. So, for example, intranasal factors as thorn and crest, it's mean of the nasal septum, yeah, deviation, lead to a reflex blocking of nasal breathing from the opposite side. Or maybe you hear that irritation of the nerve branches of the nasal cavity in some people can lead to bronchial asthma attack. and the irritation in the other organs causes changes in nasal cavity. And during pregnancy, it is very often you can meet situation as rhinitis of pregnancy. Of course, it is not only depend on reflex, but also in general hormonal changes in organism. And that's why it is very important to remove deviations of nasal septums, yeah, because they can lead to some abnormal reflexes from the nasal cavity. So, conditioning function, air humidifying and warming. What does it mean? 500 milliliters of liquid are allocated in the nasal cavity every day. And thermoreceptors of cold and heat influence the cavernous venous plexus. What does it mean? As we say that goblet cells and glands produce mucus, yeah, or liquid. This liquid consists of biological active substances that fight with bacteria and viruses, but also this liquid humidify the breathing air. And you know that mucociliary transport, yes, is directed from the anterior parts of the nasal cavity to nasopharynx, yeah, and it is very important, yes, because if all this liquid move from the nose, yeah, everybody of you will have runny nose every day, yeah, and you may lost 500 milliliters of liquid every day. So the nature create this transport in such form that we don't miss this liquid, yeah, and this liquid appears in our stomach and transform to different nutritional agents that later appear in that stay in our organism. What about thermoreceptors? Thermoreceptors are localized in mainly in inferior concus, and they play very important role because if you breathe in the warm air, the receptors of this plexus constrict blood vessels of the constrict blood vessels that localize in inferior concha, and it lead to increasing of and it lead to and it leads that inferior concha become smaller and the nasal cavity enlarged, yeah, and due to this the breathing in air become more cooler, and if we breathe in cold air, the situation is opposite. The inferior concus enlarged, and due to this air become warmer. So what is information function? Nasal cavity mucosa is constantly communicate with an antigenic material. Epithelial cells are antigen presenting, and the nasal cavity informs an organism about antigenic structure of the environment. Clear. So, due to this, we can say that nasal cavity mucus also is a part of immune system. How we can detect mucociliary transport system? Yeah, here you can see a special, very thin film colored with blue, and this film membrane, yes, is placed to the anterior part of middle concha, and with endoscopic equipment, yes, we can see how this film, how this membrane will move along middle nasal concha up to nasopharynx. So, what are the methods of investigations of nasal cavity? It's anterior rhinoscopy. Yeah, anterior rhinoscopy. When you will have classes, we of course show you some films. Yeah, and you can see how to do this investigation. And during anterior rhinoscopy, usually, yeah, we can see mucus, we can see the consistent of mucus, we can see of mucus layer, of course. We can see the consistency of this mucus layer, we can see the color of this mucus layer, we can see discharges from nose, the type of discharges, yeah. We can see nasal concus, mainly middle and inferior. And of course, we can see nasal septum. And it is posterior rhinoscopy. During posterior rhinoscopy, you can see the nasopharynx and posterior part of nasal cavity. Yeah, what we can see. So it is. So there is coans, one coan, two coan, nasal septum, middle nasal concha, inferior nasal concha, and here it is possible, possibly adenoids, you can see. But I want you to understand that these methods of investigation was routine maybe decades ago, but nowadays, of course, it depends from the equipment of the hospital or polyclinic when you work. Of course, it is better to use endoscopic technique, because only endoscopic technique allow you to investigate nasal cavity and all zones of nasal cavity in correct form, and you can see such things that you can't see during anterior and posterior rhinoscopy. What is acute rhinitis? Acute rhinitis, it is an acute inflammation of nasal mucosa. Usually it has three stages: catarrhal stage, hypersecretion stage, and purulent stage. What is chronic rhinitis? Chronic rhinitis is a chronic non-specific dystrophic process of the mucous membrane of the nasal cavity, which develops as a result of the prolonged and often repeating acute inflammation or without the interaction of some exogenous and endogenous factors, and also as at constitution anomalies. So just from this definition, you understand that the reason of chronic rhinitis may be connected not only with problems of nose itself. In structure of ENT disease, it takes the second place. Up to 50% of the population has this disease. And for example, in the United States, 12.5% persons are diagnosed. So, what are etiopathogenous factors of rhinitis development? Mechanism of primary chronic rhinitis development. The reason that causing stagnation of nasal cavity mucosa may be divided to local and general. So local are adenoid vegetation, septum, deviation of nasal septum, foreign bodies, coan, atresia, neoplasm, synechia. One minute. And just only with these local factors, ENT specialist can deal alone, because in a case of general reason, we need communication with other specialists. So what it can be? Cardiovascular system pathology, not only liver cirrhosis, but gastrointestinal problems, chronic kidney disease, diseases of lungs, chronic dysmenorrhea, pregnancy, endocrine disease, such as diabetes, hyperthyroidism, acromegalia, gout, and of course it's not all the possible reasons of chronic rhinitis. Action of external factors. Professional harm. Does smoke, gases, dry damp air, meteorology factors. Also, remember about drug abusing, action of some medical preparations, as of general action, so for local action, and what about local drugs? It's vasoconstrictive drops, you know that, I think from the pharmacology, that prolonged using of vasoconstrictive drops can lead to chronic rhinitis, constitutional predisposition, change of an organism reactants, allergic rhinitis. So, classification of rhinitis. So, all rhinitis may be divided in two big groups, infections or non-infection. Infections can be acute and chronic. Acute is viral, bacterial, or traumatic. Chronic, non-specific, and specific. Also very important group, it's allergic rhinitis, and it is a real big problem for nowadays, because you know that allergic processes are very widely spread in the world, and the frequency of this disease increase from year to year, and very often and quite often allergic rhinitis is matches with other atopic allergic processes as bronchial asthma, which is quite severe and dangerous disease, and atopic dermatitis. Another group, it's vasoactive rhinitis, so drug-induced, hormone-induced, food-induced, temperature-induced, psychogenic, and idiopathic. Hypertrophic rhinitis, atrophic, also maybe other conditions followed by rhinitis, and also there is classification, you will see a little bit later, so non-allergic rhinitis with eosinophilia syndrome, NARES. Classification of chronic rhinitis. It is chronic catarrhal rhinitis, chronic hypertrophic rhinitis, simple cavernosus hypertrophic rhinitis, and hyperplastic fibrous rhinitis, diffuse and not focal, is mistake, local. Chronic atrophic rhinitis, simple form, and fetid chronic atrophic rhinitis or ozina, and also vasomotor rhinitis. So what is chronic catarrhal rhinitis? Clinic, yeah? So as all problems with nose has such symptom as nasal obstruction, yeah, or bad nasal breathing. In the case of chronic catarrhal rhinitis, it's because of mucosa accumulation. Yeah, it's maybe periodic or alternate strengthening on a cold. Other symptoms, it's mucus secretion or running nose, sense of smell infringement, lacrimation, neurologic pains in the paranasal sinus region. What we can see during endoscopy, yeah, inferior nasal conchas are enlarged because of edema, or in later state it's due to hypertrophy of undermucous layer, hyperemia of mucus, and mucus in nasal metastasis. Yeah, here you can see mucus. So mucus usually is non-purulent. Yeah, it's clear watery mucus discharge. Treatment. So, as any disease, if it is possible, you must eliminate the rhinitis causing factors and exclude other form of rhinitis. So, what means elimination of the rhinitis causing factors? So, it means that if a patient has nasal septum deviation, yes, you must operate and you must remove this deviation. Yeah. Not to abuse vasoconstrictive drops. It's very, very important things, and you know that all instructions to vasoconstrictive drops, it is written that this form of drugs may be used only 5-7 days. Yeah. Because after, if you use it longer, you or the patient, or if the patient use these drops longer, the patient may have abuse to this drop. One minute, I'll see something. Yeah, so prolonged using of vasoconstrictive drops, yes, can lead to addictive to these drops, yeah, and sometimes the patient has no very significant problems with nasal cavity anatomical structure, yeah, but it so happened that he or she start to use these vasoconstrictive drops and used more than 5-7 days, and after that it is very difficult for him to stop using of these drops. because such patients has addiction to these drops. And what mean addiction? Yeah, so to breathe well, yes, to have full nasal breathing, such patients need to drop these drops every day, because if the patient stop this using of these drops, it lead to such phenomenon as edema of nasal cavity mucus without these drops. And also you may use physiotherapy. Yeah. So chronic hypertrophic rhinitis, morphological changes. At cavernous form, the number of blood vessels increase, and hyperplastic form in all sides of mucosa proliferative process is observed. Yet cellular infiltration, fibrous tissue, cyst formation, concha, osteal hyperplasia. So mainly the symptoms are the same. It's the nasal breath difficulty, constant discharges from nose, nasal drip, infringement of smell sense, headache, reflex cough, sometimes audition decrease, and nasal shade of voice or rhinolalia clausa. So, rhinoscopy, yeah? Nasal myotasis are narrowed, mucosa is brightly red or cyanotic, mucosal edema and hyperplasia bottom of inferior and middle nasal concha. So you see that the inferior nasal concha are hypertrophed. So there is hypertrophy of inferior nasal concha. So as anterior part as so posterior part. Yeah. So how to differentiate the form, the cavernous and hyperplastic forms? Yeah, you may irrigate, or you may irrigate conchas with adrenaline solution. So if you see constriction of blood vessels that lead to decreasing in volume of inferior concha, so it is cavernous form. If there is no decreasing in size of inferior concha, so it means that you deal with hypertrophic form, with the hyperplastic form. Treatment. So treatment may on the first stages, if this situation is connected with abusing of nasal drops, of course you need to avoid nasal drops constantly. But sometimes situation is more difficult, and in this case we need some manipulation. Yeah, for example, electrocauterization or submucosal electrocauterization. Of course, it's better to use submucosal electrocauterization, because in this way you avoid damage of mucus, and it is very important. Protection of mucus of nasal cavity, it is the main aim during all operations in nasal cavity. So also it may be clear destruction with sorry, I'll say with nitrogen, yeah. Also, it may be inferior turbinate submucosal ultrasonic composition, cauterization with laser beam, or also concatemia, inferior turbinates lateral position, or inferior turbinates submucosal vasotomia. So lateral position, it means that firstly you place the inferior turbinate medially to nasal septum, and then you return it to the lateral wall. Simple chronic atrophic rhinitis. Etiology, yeah, it is external condition and professional harm, constitutional predisposition and hormonal infringement, neurostrophic breakdown, infringement of ferrum exchange in children after infection disease, after expanded operative interventions in nasal cavity. So morphological changes, yeah, it's opposite as in hypertrophic rhinitis, yeah. Metaplasia of cylindrical ciliary epithelium to mutilate flat, complex cells disappearance, reduction of mucous glands and blood vessels number. So yeah, you can see that nasal cavity become enlarged in size. Clinic, yeah? Dryness in nasal cavity, scap formation, periodic small nasal bleedings, nasal breath difficulty, infringement of smell sense, and during rhinoscopy you can see wide myotasis, turbinates are reduced or decreased, yeah, in volume, mucosa is pale, dry, covered with scabs. And the most severe form of chronic atrophic rhinitis is azena. This disease is well known from the Hippocrates, and the main reason of azena is infection. Yeah, it's so-called Klebsiella azena. There are also maybe other factors, yes, such as neurodystrophic processes, alimentary, avitaminosis, anatomic factors, and hereditary diseases. But main factors are infections and deficiency of ferrum in blood serum. What can we see in morphological changes? It's complete metaplasia of cylindrical epithelium into mutilate flat. Mucosa is almost deprived of mucous gland, obliterated endartereitis phenomenon in blood vessels, and sharp atrophy of nasal turbinates up to osteal skeleton. So, yeah, and you can see if we have metaplasia of functionating cylindrical epithelium to multilayer, it means that all functions of protection, yeah, are switched off. Clinic, yeah, dryness in nose, nasal breath difficulty, and it's very interesting phenomenon, yeah, because you can see from the morphological changes, yes, that mucosa is atrophic, yeah, and you may think that is the mucus is atrophic, the nasal cavity enlarged, so such patient must have good nasal breathing, but no. Nasal breath difficulty, it's due to scap formation, and also it's due to as nerve branches localized in mucus, and these branches also give us the feeling of breathing, and if these branches are atrophic, it leads to situation when yeah, the patient breathe in air, but he or she can't feel this fact, and sometimes and quite often they complaint to nasal breath difficulty. 1 second. So what are another symptoms maybe? Yeah, it's sharp, it's bad odor, yes, bad smell from the nose due to formation of this scab and resistant anosmia, rhinoscopy, yeah. Nasal cavity is considerably expanded, but all the volume of this nasal cavity may be covered with this bad smelling scab or membrane. Sharp reduction of turbinates. These scab or membranes are of dark green color, yeah, faded smell from nose, and resistant anosmia. So treatment. Treatment is very problematic in such patients, and firstly, of course, we must eradicate pathological agent, yeah. So it's antibacterial therapy. You must give a patient, such patient, preparation of iron or ferrum, yeah, and also maybe use vitamin and biostimulators. And locally, it's very important to humidify mucosa, yeah, because due to atrophy of mucus, there is no natural mucus layer in nasal cavity. So it's very important to artificially humidify this mucosa. Irritation procedure, yeah, with different solution. And sometimes we can use surgical methods of treatment, yeah, that lead to narrowing of nasal cavity. Vasomotor rhinitis, the triad of characteristic symptoms. It's complicated nasal breathing, repeated sneezing, plentiful mucus or serous discharges from the narrow nasal cavity, and allergic form of this rhinitis. So you know that allergic, yeah, it is understandably that allergen plays the leading part in the etiology. There are two main forms of allergic rhinitis. It's so-called intermittent or persistent, yeah, and previously intermittent, or you may know intermittent rhinitis under the name of seasonal and polynosis, and persistent, it's annual rhinitis. So it's the symptoms can be met during the whole year. On this slide, yes, you may see the difference here between these two forms of rhinitis, and I think that we will speak about it more in details during our lessons. But mainly, yes, what you must know that there is such international paper area, yes, it means, yes, it's abbreviation from acute rhinitis and its impact to bronchial asthma, yeah? And it is the international paper that is used in the whole world, and in this paper all definitions are given and their strategy of treatment. If we are speaking about intermittent rhinitis, it means that symptoms of this are less than 4 days per week, or less than 4 weeks episode, and persistent symptoms more than 4 days per week and more than 4 weeks during the year. And there are middle, moderate and severe, mild, moderate and severe forms. Yeah. So mild form is normal sleep, normal work and school, normal daily activity, no disturbing system. Moderate to severe, yes, is disturbed sleep, problems at work and school, impairment of daily activity and sports, disturbing symptoms. Rhinoscopy, what we can see? Yeah, we can see express edema of mucosa, pale porcelain painting of mucosa, or it's something like slight blue color of mucus, and hyperplastic changes of mucosa and sometimes polyps. Uh, Differential diagnosis. Yes, for the allergic form are characteristic allergic rhinitis in the anamnesis, eosinophilia in blood, eosinophilia in nasal secretion, positive skin test with allergens, seasonal prevalence for pollinosis and heredity. Treatment. The key point of treatment of all allergic process is avoiding of allergen or allergen elimination. Of course, sometimes it is impossible. Because of course sometimes it is impossible, but we need to do everything to do this. Upper airways and nasal cavity sanation, it means that you must you must operate all situations in nasal cavity that lead to grossing situation, because of course you must understand that, for example, if a patient has allergic rhinitis and deviation of nasal septum, if you operate deviation of nasal septum, you will not treat a patient from allergy, but it allow a patient to breathe more freely, yeah, and during exacerbation of the process, yes, the patient will breathe better, yeah, because his nasal passages become wider. It is maybe specific immune therapy. We will speak about it on lessons. Non-specific hypersensibilization, it's antihistamine preparations. And of course, stabilizers of stabilizers of mast cells membranes, and the key drug in treatment of allergic rhinitis is nasal local corticosteroids, yeah, in nasal spray form. Other forms of vasomotor rhinitis are treated with elimination of anatomic anomalies in nasal cavity, downturn of the raised nervous system reactions, and reflex therapy. And here you can see other form of rhinitis. So you can see that it's very different form as from etiology as for pathophysiology processes. It's NAR, non-allergic rhinitis, and INRR, non-infectious, non-allergic rhinitis, NANIPER, non-allergic non-infections, perennial rhinitis naris, non-allergic rhinitis with eosinophilia syndrome, NARMA, non-allergic rhinitis with mast cells, NARNE, non-allergic rhinitis with neutrophils, and NARESMA, non-allergic rhinitis with eosinophils and mast cells. And now, so as a result of this part of lecture, you can see that rhinitis is a very, very widespread disease, and very often it's connected not only with the pathology of nasal cavity by itself, but the problems in other systems of organism. Sinusitis, yes, is an inflammatory disease of paranasal sinuses mucosa. 5% of population suffers, takes the third place in the ENT disease structure, make up to 36% of treatments as inpatient department, and 50–60% of outpatient treatment. It may be the source of infection sensibilization of the respiratory ways and lungs, and may be the reason of orbital and intracranial complications. There are anterior and posterior groups of paranasal sinuses. To anterior group, we inferior group include frontal, maxillar, and anterior cells of ethmoidal bones labyrinth. And remember, when we are speaking about anatomy, yes, we spoke about osteomeatal complex, and this osteomeatal complex is localized in middle nasal meatus, yeah? And all these sinuses are open in the middle nasal meatus. So I want to repeat for you that all problems, yeah, with the middle nasal meatus and osteomeatal complex can lead to chronic problems with this group of sinuses. And posterior group of sinuses is the posterior cells of ethmoidal bone and sphenoidal sinus. And these sinuses are open in superior nasal meatus, or more correctly in sphenoethmoidal recesses, that is localized on the level of the posterior end of superior nasal concha. Yeah, just for you to remember about osteomeatal complex and its role in development of different form of sinusitis. Frequency of paranasal sinuses inflammation. So on the first place, it's the maxillary sinus inflammation, maxillary sinusitis or enteritis. And more common way for infection is from the nasal cavity or the teeth of the maxilla. Yeah? So we are speaking about connection of ENT organs with other regions. Yes. So here you can see the teeth. So from the 4th teeth to the 8 teeth from the on the maxilla, yeah, all these teeth connect with the flow of maxillary sinus here, yeah, and it means that the infection from the root of this teeth can lead to infection of maxillary sinus. On the second place, it's the cells of ethmoidal labyrinths, ethmoiditis, and remember that at children of younger age, it's up to maybe 5 years. Ethmoiditis is on the first place among the inflammation of all sinuses. Third place, it's the inflammation of frontal sinus, and on the fourth place, it's inflammation of sphenoid sinus. Also, you may make such terms as polysinusitis, hemisinusitis, and pansinusitis. What is polysinusitis? Polysinusitis is when the two sinuses of different locations are involved in process. For example, inflammation of maxillary sinus and frontal sinus, yeah, or inflammation of maxillary sinus and ethmoid sinus. It means polysinusitis. Hemosinusitis is inflammation of all group of sinuses from the one side. Yeah? For example, left side or right side. And pansinusitis is a situation when all sinuses are involved in inflammatory process. So what is necessary for normal functioning of paranasal sinuses? It is constantly opening of discharge apertures, and you remember that sinuses, natural osteums through which sinuses are drained in nasal cavity are localized in middle meatus and in superior meatus. High efficiency of mucociliary transport system. Yeah, the secret from the maxillary sinus is re-innovate for 20 minutes. Yeah, and you know that there is some hereditary disease that are connected with damage of movement of cilias of cells. Yeah. And the high oxygen contents in paranasal sinuses. Yeah, and high oxygen contents in paranasal sinuses may be only in a case of high efficiency of mucociliary transport system and constantly opening of natural osteums. Sinusitis etiopathogenesis. Yeah. Their reasons may be bacterial, viral, or fungal, or mixed. In acute sinusitis, monoflora is more often. In chronic, mixed flora. The reasons promoting sinusitis occurrence and their transformation in the chronic form. Decrease in the reactance of the organism, local mucosal immunity disease, allergy, microflora virulent features increase because of irrational antibiotics usage, virus and fungoid infection prevalence, and of course don't forget about local factors. Yeah, local factors. It's the problem with paranasal sinuses draining. It's septonasal deviation, hypertrophy of nasal turbinates, adenoids, nasopharyngitis, narrowing of paranasal sinuses discharge osteums, and defects of paranasal sinuses mucosa. What are the ways of penetrations of infections into paranasal sinuses? It's maybe rhinogenous, gematogenous, traumatic, or odontogenous. So, what is rhinosinusitis? Is a significant health problem which seems to mirror the increasing frequency of allergic rhinitis and which results in a large financial burden of society. It's also one of the very important document. Yes, it's European position paper on rhinosinusitis and nasal polyps. Rhinitis and sinusitis usually coexist and are concurrent in most individuals. Thus, the correct terminology is now rhinosinusitis. Most guidelines and expert panel documents now have adopted the terms rhinosinusitis instead of sinusitis. The diagnosis of rhinosinusitis is made by a wide variety of practitioners, including allergologists, otolaryngologists, and other specialties. And it's quite logically because it's difficult to image how maybe, for example, maxillary sinusitis without damaging of nasal cavity mucosa. So, clinical definition of rhinosinusitis in adult. It's quite long definition, so you may see on this slide, and you may make a copy. And also the definition of rhinosinusitis in children. So very important to determine with what form of sinusitis we deal with, acute or chronic. So acute form is continue less than 12 weeks and complete resolution of symptoms, and chronic more than 12 weeks without complete resolution of symptoms. So, classification of sinusitis on the process prevalence. Yeah, it may be maxillary, maxillary sinusitis, ethmoid sinusitis, frontal sinusitis, sphenoidal sinusitis, hemisinusitis, pansinusitis, and their combination. On the cause, character, and the form of defeat: acute, chronic, and if we are speaking about rhinitis, vasomotor. Yeah. In the cause of occurrence or the way of penetration of pathological agent. It may be rhinogenous, odontogenous, or traumatic. And on the character of pathogenic agent: viral, bacterial, fungoid, and mixed. Acute sinusitis. You can see what changes are present on the mucus, yeah, during this form. The stages of inflammatory process or the character of inflammatory process may be catarrh, purulent, and necrotic, and the type of exudation may be serous, mucus, purulent, fibrinous, and hemorrhagical. Clinical feature. So headache, yeah. The headache, the localization of headache can be different and depend on the localization of inflammation, yeah. And you can see that the localization of the headache differ depending on the localization of inflammation. And other symptoms are nasal obstruction, nasal cavity discharge, hyposmia, lacrimation, reflex cough, nasal voice, temperature increasing, and puffiness of soft tissue of the face. So, what is post-nasal drip? Yeah, usually the nasal discharge are from the nostrils, but commonly, if the posterior group of nasal sinuses are involved in process, the patient can feel this discharge on the posterior wall of nasopharynx and then pharynx. Yeah, and you can see, if you observe such patients, you can see this discharge on the posterior wall of pharynx. Yeah, it's so-called postnasal drip. Chronic sinusitis. Morphologically, you can see hypostasis, cellular inflammation, and proliferative phenomenon. There are three main forms. It's purulent, polypose, and purulent polypose form. Diagnostic, of course, it's percussion palpation, rhinoscopy, and strongly recommended using of endoscopy. X-ray examination, these three types of investigations are not frequently used, and CT scan or MRI, and of course cystoscopy with endoscopic techniques. In former Soviet Union and later in other countries was used such procedure as puncture of different sinuses. Nowadays, in our country, mainly use puncture of maxillary sinus with special needle. Sometimes very rare, and as far as I understand, in countries with good equipment, this procedure is not used nowadays, is so-called frontal sinus trypanopuncture. And nowadays, with widespread using of endoscopic technique, of course, this operation and other operations mainly use endonasal except to all groups of paranasal sinuses. Treatment of acute sinusitis. It's, of course, antibacterial treatment. Hemisynthetic penicillin is the first line of antibiotics. If the patient has pain syndrome, it's non-steroid anti-inflammatory drugs such as ibuprofen, paracetamol. Sometimes you may use secretolytic drugs. Nowadays, very commonly is intranasal topical corticosteroid using and other constrictive nasal drops. But yeah, as we spoke, remember about duration of treatment with nasal drops, not more than 5-7 days. And puncture of paranasal sinuses, mainly, of course, maxillary sinus, and different types of lavage of sinuses. So, chronic sinus treatment, conservative and operative. Indications to operation, orbital and intracranial complication, polypose forms, odontogenic maxillary sinusitis, and inefficiency of conservative treatment. Operative access to paranasal sinuses are divided to extranasal and endonasal. And nowadays, all surgeons, and it's strongly recommended to use endonasal access to paranasal sinuses. Extranasal in very, very, very rare and to very, very strong indications. So about endonasal we will speak about during our lessons, yeah. But the main idea is to deblock the zone of osteomeatal complex. So rhinogenous complication may be orbital and intracranial. Preconditions for rhinogenous complications is anatomic affinity and neurovascular links. Ways of infections penetration may be contact, hematogenous, lymphogenous, and traumatic. Orbital complications are more common in children, and here you can see the types of orbital complications. And intracranial complications, fortunately, it's quite rare situation, but you must remember about possibility of such complication, especially in the case of chronic form and chronic polypose form of sinusitis. For today, it is everything what I want to tell you. I hope that everything was well heard and seen. Yes? Was there any problem with translation of lecture? Colleagues, are you hearing me? Okay, so the next, wait a minute, I'll tell you when you will have the next lecture. So the next lecture you will have on 15th of September. Clear? At the same time. And I want you to remember, yeah, group, group 173A. We start our practical lesson also on 15th of September. The members of this group, we must to create a group in VK for our lesson. So Monica Degur, please accept my invitation to friend, and we create a group. Okay? Okay. So I again congratulate you with the beginning of new studying year, and they are members of group 173A. We will meet on the 15th of September. Good luck and see you soon. Скажите, у меня вот такой вопрос. А вот мне как-то, не знаю, можно выцепить вот этот вот